Currently, there are more than 100,000 cases of COVID-19 worldwide, and 3,500 people have lost their lives. We also have 6 presumptive cases here in New Jersey. With that news, I know many of us want to know how to best protect ourselves and our families. We know that many cases of COVID-19 are relatively mild. Some may seem just like the average flu, which means a lot of people may not go to get screened. But because the risk remains greatest for older people and those with underlying health conditions, those who may have an immunodeficiency, we all need to practice common sense measures to prevent its spread. And of course, we've heard this many times, but it goes without saying, washing our hands, coughing into our arms, and staying home when we're sick, and I want to talk about that a little bit in just a moment. However, I know that for many working families, that often isn't a choice. Missing work too often means missing a paycheck. And while I'll continue to fight in the Senate to make paid leave a reality for every worker in America, this week I'm also calling on major employers across the nation, some of which have taken it upon themselves to do exactly this, to be more flexible, to embrace things like telecommuting, and not to punish workers who have to stay home because they're sick or under quarantine. I'm also in conversation with fellow members of the Senate Finance Committee, of which I sit on, because it seems to me that we have to prioritize the health and safety of the public first before we start talking about tax cuts to affected corporations. We certainly understand the desire to help companies that may be struggling, for example, as a result of the cruise industry. But before we do that, I want to take care of average Americans who are also going to face some incredible challenges. Paid sick leave for workers impacted or who are under quarantine orders, those responsible for children in case of school closures. On the way here, I had one of our radio stations on, and I was listening to the growing list of school closures. Well, when parents still have to work and there are school closures, depending upon the age of that child, who is taking care of that child if there is not another family member to help? They are going to need some economic help in that regard. Enhanced unemployment insurance for those who may lose their job because of this outbreak. These are just some of the type of economic relief we have to provide to families during this period of time. Likewise, and I appreciate that Joan mentioned this, I have urged the Department of Homeland Security to pause immigration enforcement at hospitals and medical facilities. We need everyone with a coronavirus-like symptom to be able to seek help without fear, regardless of their immigration status. And I recently hosted one of the briefings for members of the Senate with all of the different departments that are involved, and I had Ken Cuccinelli, who is the Deputy Secretary of Homeland Security, and I pressed him. I said, I do not want to see ICE agents at health facilities, hospitals, and other things, because disease, viruses, knows no quarter. And we cannot afford to have any part of the population who may feel ill not come forward to get the appropriate treatment. Assemblyman, join us up here. I appreciate you being here with us as well. I wanted to come to a community health center today because for many uninsured and low-income New Jerseyans, providers like North Hudson Community are the first place that they can turn to for help. And New Jersey's health centers always rise to the challenge of ensuring everyone in our communities have access to high-quality care. No one should be discouraged from seeking help just because they're afraid of the cost, especially during a public health emergency. We need everyone who falls ill to be able to see a doctor, get tested, get treated, and take the precautions necessary to protect the community at large. Because if you fear you can't afford to see a doctor, and you do have coronavirus, you risk exposing your spouse, your children, your neighbors, and your coworkers, and so on. At a time like this, when our country faces a real legitimate public health emergency, it's maddening to me that this administration is working overtime to undermine access to affordable health care. Under this president's watch, we have seen an increase in the uninsured rate for the first time in a decade. And he recently sent a budget to Congress that slashes Medicare and Medicaid. Likewise, the administration will soon head to the Supreme Court to argue that the Affordable Care Act be struck down, leaving millions of Americans uninsured and millions more without essential benefits like coverage for emergency room visits and free primary care. Think about that for a second. At a time when our healthcare system is getting overtaxed, when doctors, nurses, and other frontline workers are putting their own health and lives at risk to treat patients, when we need people who are sick to get tested and treated, the president is trying to make it harder for everyone to see a doctor. It was wrong before the coronavirus outbreak, and it's disastrous today. That's why earlier this week I wrote the Secretary of Health and Human Services urging that they suspend their assault on the Affordable Care Act. Fortunately, from day one, Governor Murphy's team has done an excellent job at a state level protecting health care access and coverage for New Jersey families. However, this isn't happening in other states. And this matters for New Jersey because outbreaks like the coronavirus don't respect state lines or international borders. We've seen that. The few cases that we have here, actually, from what information we have, seems to, for the most part, been contracted by interactions with people outside of the state. Take someone who lives in a state that blocked Medicaid expansion. If they have coronavirus-like symptoms, they may not be able to see a doctor. They may go to work when they should have been under quarantine, and they may spread the virus to someone in their neighborhood who is headed up to visit a family in New Jersey. Unfortunately, the president's reckless health care policies are only part of the problem. The administration was caught so flat-footed in the face of the coronavirus threat. It is beyond my imagination that for 4 consecutive years, this administration has sent us a budget that each year of those 4 years cut the Center for Disease Controls by $1.2 billion a year. $1.2 billion a year. And dismantled the Global Pandemic Unit at the National Security Council. That's why that unit existed, for moments like this. Fortunately, Democrats and Republicans in Congress came together and demanded a more robust and proactive coronavirus response. Last week, both parties came together to pass an $8.3 billion emergency supplemental that will dramatically strengthen our health care defenses against the coronavirus. Our package includes many measures I've been calling for, including more than $3 billion for the research and development of vaccines, therapeutics, and diagnostics. By the way, some of you were with me at Hackensack University Medical Center's laboratory, where they had a test that they had developed that can turn it around in 2 hours from the moment they test somebody to the moment they have a diagnosis. They needed a sample. I'm happy to say I got them the sample of the virus, and they are now validating their tests, and hopefully that will be put into place very shortly. More than $2 billion also to help federal, state, and local governments prevent, prepare, and respond to the crisis. And nearly $1 billion to invest in healthcare preparedness, purchase critical pharmaceuticals and medical supplies. Likewise, the supplemental package includes $100 million to help community health centers shoulder the burden of coronavirus-related costs. It also ensures the federal government will reimburse states like New Jersey that have already devoted significant resources like personnel, lab equipment, and medical supplies to this threat. In fact, late last week, the federal government reimbursed $1.75 million to New Jersey for the costs incurred to date. After fighting hard for so many weeks to make our state whole, I'm glad the efforts paid off. Let me close by saying the following. We may not have a coronavirus vaccine yet, But this $8.3 billion will be like a shot in the arm for the healthcare workers, scientists, and public health experts working around the clock to protect the American people. And if we end up needing more to combat the coronavirus, I'll take on that fight. As I've said before, we need a seamless, coordinated federal, state, and local effort. The state is doing what it can. Local health departments and providers like North Hudson Community Action are doing all they can, but they can't do it alone. We need the federal government to be on its game. That's why I'll continue to hold the Trump administration's feet to the fire to make sure they do everything in their power to protect public health and ultimately save lives.